There's a blood test called PSA that we recommend men have from the age of 40. The blood test doesn't diagnose that you have cancer, but if it is above a certain level, it means your prostate is a little more detailed. And that is how you can, the best way of picking up early prostate cancer. We can also examine the prostate. I'll show you how it's done. Because of where the prostate is, the only way of accessing it is through the man's back passage, and Russian men don't like that. Right. So most of our men, like I say, by the time they come to us, their PSA is greater than 20. PSA, when your PSA reaches 20, your chance of cure is 50-50 if I have to do an operation. If I can't catch you with your PSA 10 or less, almost certainly we could cure you. Between 10 and 20, if your PSA is between 20 and 20, you 70% chance that the disease is confined. If your PSA is going above 40, like I say, half of the men who come have a PSA of greater than 50, it's not possible to cure them. You could treat them, but it's not possible to cure them.
The higher your PSA, the higher chance the disease will spread outside of your prostate.
So as the man lies on his side, and over years from, you know what the normal prostate is supposed to feel like, smooth and rubbery. The first thing you feel if a man has an abnormality, you have a bump on your face and you pass it in the roughness. Then as the disease progresses, you get like a nodule, which is almost hard as a stone. And then the entire prostate after the disease, aggressive disease, the entire prostate literally becomes hard as a rock. And by then, usually you're not able to cure these patients. So the test to diagnose, one is the examination, which, because I've been back and said, Dr. Christi, what I'm finding is that to get men to come forward, I can really have an exam. But it's very rare for you to have prostate cancer and to feel something without a blood test behind. So if you do not want to have the exam at this, we will allow you to do the blood test. And if the blood test is not normal, you need to examine your prostate. But do not come because you're afraid of, or they are afraid of having the exam. So X-ray and ultrasound, and of course nowadays MRI available. I'm sure you're aware of things to co-advertising heavily. They have a new machine that they want to pay for. But it does help with the diagnosis, but usually it's after you see the neurologist you get the for the test. But now everybody is just having an MRI. Right, so now I mentioned that prostate cancer has no symptoms, and the reason is because most cancers of the prostate happen on the back of the prostate. So this is the prostate here, that's the bladder. The man's urine passage goes through the middle of the prostate. Alright, so you could develop cancer and it could even start spreading without affecting your urinary passage at all. So that's why you have very little symptoms with cancer. There's another condition that also happens as we get older, which I will talk about, enlarged prostate. And that tends to happen on the inside of the prostate, and you will have some symptoms, but they not both happen as you age, but one doesn't cause the other. So as I said, most of our men, they come very late, either locally advanced, meaning the disease that starts spreading in the organs around the prostate. There's still treatments, but they can't cure you at that stage. Right, so the enlarged prostate is called benign prostatic enlargement, and what benign means it's not cancerous, unlike the prostate cancer. And it's a growth, again, similar to prostate cancer as we get old, happens on the inside, as I said, and it's very, very common. So a lot of the men you see who end up choking and ending up with a catheter or tube is because of the enlarged prostate. And as we age, it's almost part, I tell patients, it's part of aging. By the time you're 50, about 60 years old, about half of men will have enlarged prostate. Not all of them will end up with trouble peeing, but if you were to measure the prostate when they at puberty and by the time all of us have an enlarged, 80% of men by the time we're 80 years old. So every decade we live, our prostate gets bigger. And treatment is not based just because you have it. So a lot of times we go to the doctor and the patients are told you have an enlarged prostate and they can't extend up. We don't just treat the side of the prostate, we treat what symptoms they cause anyway. Just elaborate. So basically this is an image showing when the enlargement happens. So I showed you the cancers on the outside. The enlargement starts on the inside and it grows and grows, and sometimes it becomes about 10 times the size of the original prostate. Literally a huge mass, just like when men get fibroids. That's where, so if you know some women, they get big, literally men that could sometimes feel their prostate coming up like a fibroid again. So these are some of the things that will give a warning that men have enlarged prostate. So in Creole, we say it's like open up to the 2 and 4 when they go pee. Literally, they feel their shoe. They straining or forcing to pass urine. A lot of men will tell you every time they pee, they need to have a bowel motion because they have to strain so much. They literally feel like they need to pass stools. They start waking up. So normally when you go to bed, you pee before you go to bed and pee when you wake up. But once you start, some men tell you they wake up to 5 times in the night to go pee because they're not emptying their bladder properly. When they pee without them wanting, the pee suddenly chokes and they have to wait for it to start again. Sometimes stop. Then they have this feeling like they're not emptying their bladder. So 3 minutes after they pee, they need to go back again. Or they're desperate to pee, but they have to be waiting for it to start because of the obstruction. The bladder has to build up a high pressure to push through. So you go there and you have to wait for a few seconds and looking up to heaven, waiting for the pee to start. Then you start going more often. So before, like I said, these are the guys you see, they rush up if you're on a minibus. They rush up, the first thing they do is look for any bush anywhere to pee. Then sometimes, you actually have time to wet yourself. And when you get other problems, like when the prostate is enlarged, you're more likely to have bleeding in your urine, or you finish pee and then it's dribbling on you as you're walking away. So effects of the enlarged prostate. So as I mentioned, because the bladder has to generate such high pressure, the muscle gets very thickened. Secondly, because you're not emptying the bladder, just like, I don't know if those of us that are old enough to remember when it's and you leave it overnight, you get the sediment form. So the sediments start forming in the bladder because the urine sits there for so long. And over time they form huge bladder stones that cause infection, bleeding, pain. If the bladder, eventually some of them, the bladder fills up gradually. They walk around with a bladder that is already full all the time, just dribbling a little, but most of the urine stays back. So the kidney is not able to pump into that full bladder because it's under pressure already, and you can actually develop kidney failure from having this thing. The diverticulum is like when a tire has too much pressure, sometimes you get a belly. So you get a belly on the bladder, and sometimes because the bladder is full, not emptying, when they lie down at night, the pressure on their bladder, they find they're wet in the bed again at night, like when they were kids. So men try various strategies. They try not drinking at night to see if they will not wake up. So they'll tell you they had their last drink. They make sure they don't have a last drink before 6 in the evening. And of course, if you have to wake up tired, obviously your sleep is interrupted. If you're sleeping next to your partner, you're also interrupted every time you get up, go to the bathroom, come back. So you interrupt your partner. You're not able to go out. If you go to the cinema, you kind of last a little movie before you have to get up and pee sort of thing. And if you're traveling, the other thing is traveling, especially like going to long trips to England, and then you want to make sure you have a seat next to the toilet because you may have to go back and forth. And of course, this causes embarrassment, anxiety, and of course, we always worry whether it's cancer that is causing this thing. And there is treatment available. In the past, it used to be only operation, but now we actually have medication which we give men to relax the prostate and allow them to pee freely and avoid them waking up at night. And a lot of men are taking this medication and are taking them for years and years and years, and they do very well avoiding surgery. There is also this class of drugs, the finasteride and the dutasteride, that if you take them long enough, they will reduce the size of the prostate by about 15 to 20% and may benefit some men. And of course, there are lots of global things that patients say help. Total metal, phygium. So we also encourage, if you have mild symptoms, you want to try them. Some patients find them beneficial. We also have our own local thing by patient. One of the common things patients tell me is quick eye. A lot of patients seem to think that there is a beneficial, there is a stinging nettle or salty. So there are some local things now. They haven't been tested, so I cannot tell you yes you would, but it's a recurring thing for when the patients come to see me sweat that they do something for them. So they surgical operations that are available. So in the same way we may have surgery to remove the fibroids, we have operations we could do. Go in and open the operation to shell out the fibroid growth. And literally you will feel like a young boy again because the obstruction is gone. I mean, it's an operation, in that case, the open one, that we have to cut you open to do it. But I've done it on men as old as 93, as a did well and went home. And lived another to 96 after that. I don't get it now to 96. Right? So then we also have patients refer to it as laser, but there's an operation we can do going through the penis where we core out the prostate without the cut. And that's, there's a special instrument that we have, you go in through and gradually you chip away and core away at the prostate, open up the passage. There's no cut on the outside. And again, men do very well. You can feel literally like a young boy. This is just demonstrating the difference between the open operation and the straight. There are also newer therapies available using other energies like laser. There is one where they put clips in the prostate that pulls it open without scraping or doing anything. So you use this, you know, like treasure cards that you use for binding paper. So it looks similar to that. They inject it and pulls open the prostate. There is something where they inject steam into the prostate, so literally you coagulate it or cook it, steam at high temperature, and you know when you cook meat it's straight, so you cook the prostate inside. What we're not sure is the duration, how long these things will last, if they will be as durable as the operation. Now, one of the common questions people ask, and I alluded to it already, is there a link between enlarged prostate and prostate cancer? They're not directly, they both are age-related. So, as we age, we approach both of them, but we do not think one causes the other. You could have a very enlarged prostate, you could have a prostate. Some men, a lot of cancers we find are very small prostates with no BPH or very little BPH, and then by the same token, you have many very enlarged prostates and they do not have cancer. So they age-related, but one is not causative of the other. Okay? And BPH, or the benign non-cancerous prostate, is more likely to be associated with problems peeing. Early prostate cancer has no symptoms. If you want to know if you have it, you've got to check. And the check is the blood test, especially the PSA test. Okay, so the next topic, sexual dysfunction. So, again, in the past, you know, we have lots of phrases in Creole as you get older, it's better than shaggy. Whatever, the men say they don't go to castries again. You buy a castry or something. Again, this is age-related. As we get older, erection for men relies on blood flow. So for the same reason we get heart attacks as we get older, the vessels in the penis start getting damaged or narrowing of the arteries. So sex problems is more common as we get older. Now you might ask, you old, you can't get an erection, why worry about sex? But for those of us who know sex really is important to men for mental health. They feel better, they're happier, they talk to you better, they have sex. Otherwise, there's one. So after sex, you don't do anything you tell them to do. No sex, trouble. Right. So it is important, and even older men that we think should not be interested in sex, it does benefit them health-wise to have it. And generally, couples who have a good sex life, they have a better relationship than this. So the men become very suspicious if they can't get any erection and you're looking at the other way. Imagining all kind of things. Right, so these are some of the conditions that can happen as I'll talk about erectile dysfunction, premature or rapid ejaculation, and male infertility. A little bit we'll talk about this. Yeah, so occasionally if you stress, you can get difficulty maintaining your erection. We don't consider that to be erectile dysfunction, but if it persists every time you go, so there are different grades of it. You have sometimes it starts and you have good erection and you fall in climax, fades and come back up. Or it comes up but it buckles under the pressure, you don't get the rigidity that you need to perform. And of course there are some guys who just don't get an erection. Whatever they do, they pray, sing, whatever, nothing is going to happen. Yeah. And so there are different grades of it, and as I said, it happens at any age, but more common as we get older. So the causes, again, I mentioned diabetes damages the nerves and unit nerves and blood vessels, damages blood vessels, high cholesterol narrows the arteries, high blood pressure. So all these things, certain medications will also do it. If you have like people who have spinal cord injury, nerve damage, liver disease, you're depressed, and recently they've added porn addiction in younger boys. So basically these young boys go and they watch a lot of porn and they have a false expectation of what is real. So when they come into a real sex act with a normal person, because on the porn they choose the guy with the bigger penis, all those things. So they are convinced the penis is too small just from watching these guys on TV, because they think everybody should have a big penis. So a lot of them end up with serious sexual dysfunction that they need counseling for years and years. And addictions generally are hard to give up. Right, so this is just a picture showing how the penis is constructed. So the penis has 3 main chambers. One carries the urine passage underneath the penis. And these are the 2 areas that actually cause the erection. So you have the skin, and the skin is loosely attached to that. So if you imagine this is like the wall of a tire. When a tire is soft, you can press on it, and then when a tire is rigid, then it will damage you. So the same thing, so basically blood gets trapped in this, just like rather than air in this case, the blood literally traps in this rigid chamber, semi-rigid, and causes it to become rigid. So there's no bone, no nothing. All it is blood, but you need the blood to get in at a rate quicker than it is going out for it to maintain the erection. And some of the problems that happen with us is where either the blood is not staying in. So this is showing a schematic of the blood vessels that bring, so these are the arteries that they open up. When the nerves give the signal, they open up and they pull these balloons. And as the balloons fill up, they compress the veins that are taking the blood away. So, right, so as these balloons fill up with blood, the vein is compressed so that the blood has time, more is coming in and going out. So if there is any problem, you cannot get enough blood in, you won't get an erection. If this mechanism to trap the blood is not working, then you'll get the erection, but goes down before you're ready. And you know how embarrassing that could be, right? Yeah, so again, the same thing, just showing another schematic of what happens. So again, when they measure the pressure inside of that white thick chamber I show you, you need that pressure to go up to, for you to get the full erection and to maintain that pressure. So things that would cause, and I mentioned that you have mild, moderate, or severe erectile dysfunction already. So when men cannot have sex, they start worrying, they lack confidence in themselves, some of them get depressed, they don't feel attractive to their partner anymore. So although sex is not essential, it does help with the general well-being of a man, both socially, emotionally, with depression or whatnot. And men some guys will go to great lengths, you don't go and tell your friend you have an erectile problem, because if you tell other people, you can go to the bar. Or you go to a lady and embarrass yourself, and she tell her friend, and her friend tell her, you gotta hide, literally, right? So a lot of guys will put on the bravado. I remember a couple came to me, and the woman of my friend, so she had already told me, well, he had some erectile problem or whatnot. So he came and we spoke and I said, is there anything else that's a problem? He said, no, I'm fine. Of course, she stood there with me. Right? I couldn't tell her about his wife. But yeah, they generally, some of the guys will come, they'll have a consultation, they talk. And it's as though when you think you finish and they go, oh, by the way. Still some men find it difficult to talk about it. I mean, it's a lot easier now, but some men find it very difficult to admit that they're not able to have an erection. And as I mentioned, some of them become very suspicious, especially if their wife is happy. She must be getting it somewhere. So they start following you and listening, everything. But over the years, the thing went off. I don't know if you're looking at power.
They didn't see, they didn't even message with it. Just went off.
Yeah, so over the years, we've researched. When I first started,
When I entered neurological training, we did not have much.
when I started training in neurology, we did not have much to offer men.
So one of the things we used to tell them when they come in was psychological.
And people still tell people that it's psychological, they need to be strong, whatnot. But of course, it's in their head when it was, yes, it was in their head, but not that head. They have a problem in their head, that's what it does then. And so, a lot of research was done, and then gradually we developed treatments. Initially, it was just, I don't know if you know, I probably had a diagram, but it should take a while to do that. So, mechanical things. So we had, the rubber rings to try and track, so we had the erection before it go down, you put the rubber ring at the base, trap the blood in, so that it will fade away before. Then we develop a pump called a vacuum device. So what it does, it creates a suction, draws the blood into the penis, and then you slip a ring at the base of the penis. Men did not lie, it was mechanical, you had to interrupt the act to go and put on your device, and when you finish, you take it out, wash it, put it away for the next time, sort of thing. So, then gradually, with research, they develop injection therapies, just like a diabetic give themselves an injection. They develop medications that the man could have a supply at home when he's ready, just inject it into the body of the penis. Within a few minutes, he gets an erection, can be stay. You could vary the dose, you could repeat the dose, and it works quite well. But again, the idea of injecting themselves into the penis frightened a lot of men. And then, I think while I was in the UK in the 1990 something, one of our lecturers came to say, everybody should buy shares in Pfizer. You should buy shares in Pfizer. Something is about to come out, and of course, nobody really believed it, because the idea of being able to take a medication to go to your penis specifically and give an erection, it sounded almost magical. And of course, it turned out Viagra did come on the scene, and Viagra was like a wake up. Now, the story of Viagra is one where the drug was actually developed as a hack drug, but they were giving it to these patients, and they kept coming back to report the side effect. They had not had sex in a while, and they were having sex. Initially, the person, people doing the research, but when they saw so many people came back, in fact, they said one guy, when this trial was finished, he actually broke into the people lab to try and see if he could find some samples. Yeah, not so well. And so the drug was released. Now, it has gotten a lot of bad press because it was the first of the class of drugs that help with erection to come on the scene. But it works quite well. If you take 100 men just without knowing what caused their erectile problems and give them Viagra, between 70 and 80 out of 100 will have a good enough erection to have sex. So it's not 100%, but a lot of men, and just from taking a pill, no injection, nobody has to know you took a pill, etc. So it worked quite well. It kind of leveled the playing field. Because of that, more men will come forward and talk about erectile problems. More men can avail to diabetic patients. The only patients who say you probably shouldn't take it, like if you can climb a flight of stairs without getting chest pain, and at the time of orgasm, your heart rate goes up, so you may end up killing yourself. But it works quite well. It is safe. I mean, there are a few side effects: headache, indigestion. Very rarely, some people get muscle pain, and of course, blue rings around eyes. But all these side effects are reducible, and the drug is safe. It is now inexpensive because everybody's making a generic brand that are made in India, made everywhere. So it is available and it has rarely changed. It is literally, as one of the time you say, you can bring the dead. Bring the dead back to life. Yeah. So from that, other companies research to find some that could have a longer effect. So in that class of drug, you have something called Tadalis or Cialis. Then there are others, but these are the two popular ones. The difference between Viagra and Tadalis is So that has a longer duration of action. So if the man takes it in the morning and let's say your wife had to rush out, you will not lose your money, you will come back. So it's not so much a problem now because at the time when the foods came out like the bag, it was like $50 for one tablet. So you literally had to know you could get your money's worth out of it. But now, like I said, there are generic brands available, they very easily so that's erectile dysfunction. Anyway, I'll talk now about rapid ejaculation, which is another problem that plagues men. So, rapid ejaculation is where, for whatever reason, the trigger for ejaculation is set too quickly. So some men will ejaculate even before they can penetrate. Literally, the woman will say, he came on my thighs or the because the trigger is set too fast. It is a real condition. It is not the man's fault. In our young days, the problem with men how we do it is when you ejaculate, the erection goes down. Now, in your 20s, if you wait a few minutes, or 30s, the erection will come back and the second one usually lasts longer, so you can satisfy the partner. But when you get to 35, the second erection takes a lot longer, maybe tomorrow, and then the ladies start trips because they're trouble again, kind of thing. So usually when men present for treatment, it's usually about that age because the second erection effect is there. And the researcher has not indicated that there is a sense in our brain we call the ejaculatory center, and the setting is a bit too fast. So there are medications you can give, simple, just one a day or on demand, and it actually helps. There are quite a number of patients. I know it works because they keep coming back for more. Years and years later. So it does work, and it is simple. And it's a very stressful condition for the man because, like I said, you ejaculate before you even, or soon after you enter, took 1 minute, literally, and then lose the erection. And like I say, when you can get the second erection quickly, it's not a problem, but when you not really get it, it is really, really, really a problem. Other conditions that can affect the penis is, because sickle cell is common in our population, one of the things in little boys with sickle cell is to get prolonged erection that is not related to sexual stimulation. It's called priapism, and the same reason they get pain and other sickle cell conditions. The sickle cell blocks the outflow from the penis, and they will have a painful erection, and it can be very distressing and very difficult to treat because there's no sexual desire that can get an erection that is not going away. And this kids end up in hospital, you have to do various maneuvers to try and bring out the erection. Priapism or prolonged erection can also happen to men who take medications to help with their erection as well. And usually, again, the same thing, the blood is trapped there and you finish sex and after a while, because the blood is not flowing freely, it becomes a painful condition. And generally that one is easier to treat by injecting a substance to constrict the arteries to prevent more blood getting in. You can treat these patients. You have to ask any questions while I read the slide. I don't know what else to do. Any questions by the way about anything I said already? Yeah, so most of the conditions that plague men or even all of us, in general health things like diabetes, high blood pressure, even women, as you know, breast cancer is pretty common in Central women. A lot of the women presenting with breast cancer are generally much younger than the men. We're not sure why, but it is a leading cancer in Central women, and a lot of young women have a lot of breast cancer. But they present late. Now, we're not sure, there's a lot of educational programs, like I said, for women, breast health examination. Is it that people ignore, they go around and they ignore it? Is it the health care professions that are not doing what they're supposed to be doing? Because if you catch most of these diseases, like I say, the first sign of alarm, there are some cancers that must confess are just aggressive from the beginning, and we kind of said that people believe they get cancer is because of a weak point, a weakness on their part, so they don't want to tell people. It's almost like it's because you didn't eat the right thing, and there are lots of these pundits out there that think they know, so because you eat that, you didn't do that. But anybody can get cancer, anybody, breast cancer, prostate cancer. It's not, there's no mark on your face. You may live the healthiest life. I mean, if you health, don't get me wrong, but it doesn't prevent you getting cancer. I had a patient who was healthy, he was a jogger, he ran how many miles every morning, and then he started having back pain. He really didn't think anything. By the time he came back to the prostate cancer he had that spread to his spine and was causing it. But he didn't check because he thought he was living a healthy lifestyle. But all of us are prone to it. So, again, for women, once a year, cervical cancer together with female cancer is still common in the future. The pap smear is available at the hospital. They probably charge $50 a child. But again, most women will not do. If you ask women when last got a pap smear, it's like, what you talking about? And once a year, quick time, look after yourself. And the pap smear is better. It picks up the cancer in a pre-cancerous stage where all you need is just a little zap and you're okay. If you wait until it has developed into cancer, start spreading, then you need to have chemo, radiation. You understand? So, for women, the same diseases I mentioned, the high blood pressure, high cholesterol, once you pass menopause, you have the same risk factors as the men have. So, once a year, check, and if it is abnormal, the doctor will advise you to see more. Then lotions are like pills. So one of the things again, my mother was like that. She used to say, you have a bad pills too. So she had an impression that all these pills were people drink it. Okay. And they were given a bad pill. The reason that so medications that we give you, first of all, is designed to last. So the one thing like for your pressure, it's designed to last for 24 hours to keep your pressure over 24 hours period. In the older days, you have to take like when you're taking antibiotics 4 times or maybe 5 times. So over time, we develop ways of making them slow release, so they release slowly. But they dissolve completely. There's no residue left in your belly or anywhere. The reason that you have to take another dose next day is because the drug is excreted or destroyed by your body. So that's why you need to put a little bit. The other question, some patients would ask me, why we don't give them liquid instead of the tablets, because we get the same notion, the liquid do not accumulate in you. But the reason why the tablets were designed is you could do the slow release preparation one. Secondly, the cost of shipping. If you put medication in liquid and have to ship it, it's a lot more, it will be a lot more costly to get it there. So tablets take care of that by compressing everything in the tablet that you can design in a way to slow release once a day and control blood pressure, control your blood sugar, etc. The other bit of general information I want to share is about, so patients come to you and you tell them they have high blood pressure. Now, one of the things is you give them a repeat prescription, but the pharmacy associations and which have become very powerful and they determine how long doctors can give you medication for. So we need to give you a 6-month repeat prescription, and patients believe because it has 6 repeats, at the end of the 6 months they don't need to take anything more. And it's one of the educational things. The maximum we are allowed to write is 6 months, but that doesn't mean you don't need the medication anymore. So when the 6 months is finished, call your doctor's office and ask for a renewed prescription. But a lot of patients seem to think that, oh, but you only gave me 6 repeats, so therefore they stop the medication and they run into trouble. So I just want to have to say that it is not because we only allow to give you, because if you go to the pharmacy and it's past 6 months, they will not serve you on the prescription, because as I said, they've become very powerful and they determine a lot of things. I'm not sure. I hope there are no pharmacists there, but I think they want them to be doctors and they So the pharmacy, the patients come and they have infections that only can work. The injection is all that can work for them. So they come to see me, and rather than admit to hospital, they get 2 injections. We organize for the news at the health center to administer, but they don't have the drug at the health center. So you must buy it and bring it. So you give the patient a prescription. And the pharmacist refuses to give the patient, or they not give the patient the injection. So what they do, they drink it. Oh, no, that is not. The guy is from, wheel or something like that. I'm going to put him in a hospital bed. And what do you have to do? There's one of them who tell me I can come and collect the medication for the patient, right in front of him, give to the patient, but he's not. No, I don't know. I just like, it's a bit ridiculous.
Okay, so I was talking about the treatments we have for erectile problems. What am I supposed to question for this?
Anything else? Somebody put that?
No. It's great.
Okay, so I was talking about the therapies that are available for erectile problem.
So these are the drugs I was talking about. That Viagra is the first one, sildenafil. Then you have the Cialis. There's one called vardenafil that is not so popular, and the new one. But they didn't add anything more, so these two remain the most popular ones. And I was telling you, in the studies they did, showing that if you gave men,
How many men responded?
both improved erections after 52 weeks of the medication and desire to continue. So men were very happy. Most of them chose. Very few men say they don't want it, they didn't like the drug because, as I mentioned to you, sex is part of our brain and side effects is not so good. Okay, so I was talking about the pump, so the vacuum erector device. So that doesn't involve no medications. So it comes with a plastic tube that goes over the penis. So some of the pumps are electrical, so you pump, you get your erection, you slip the band on. When you finish, take out your band, wash it, and next session. So it's a bit mechanical and people don't like it, but half a loaf is better than no bread. So the injection, you get it's just like the same little needle like a diabetic needle, and you inject into the base of the penis. So you inject into the base of the penis at the side, and literally you get a normal erection within a few minutes. You can decide if you want to go for an hour, you put a little more, half an hour, a little less, and it works well. But it's an injection but it's not as painful because of where you inject him along the side of the penis, and the people that use it are very happy with it. So when men became afraid of the injection, they developed the drug as a little pellet with an applicator that you put into the penis and then rub the penis to dissolve it, but it never was as effective. But again, and then the last resort, if nothing works for you, you could have an implant. And this is, it's a small operation. The implant has 3 parts. You have these 2 plastic cylinders, so you rim out the soft tissue in the penis and you put these 2 cylinders. You have a valve here, so the man has an extra testicle sort of. And up here is a reservoir, a balloon filled with fluid. So when you're ready, you activate it. The fluid runs from there, comes up, increase. When you finish, you deactivate, put it away next time. Yeah. I spoke about the rapid ejaculation and told you how distressing it can be. And I told you, it's quite common. People don't talk about it because of the embarrassment. And so, but it is a common condition. It is treatable and easy to get an erection. And anytime your erection goes beyond 4 to 6 hours, it starts becoming a humbug because it's just not going down literally. And some guys, it gets painful. You could go for a cold shower. One of my friends in England says, I call it. So what happens is, normally the first thing that happens is you get an erection. more common as we get older. As before, you wanted a lot of sex, all of a sudden you're not so interested. You know, kind of thing. Frequency of erection. You may still get erection, but the frequency of erection may go down. And as I said, reduce strength, reduce energy. There is now, you don't see any stool come out. So you have sex, you experience orgasm, stays in the prostate or goes back into the bladder and comes out in the urine. It's not usual. Anyway, so that's some of the things that I talk about. If you have any questions, right? These are very sad. Okay. So yeah, maybe so the final cancer, you can get to ET, which is terrible. So you're not very interested in that, but hopefully eventually as we become more aware of our own things, we may be able to do that. But it is common. In magnet, they have similar high rates, but they were blaming it on some chemical they use in the banana industry magnet. Yeah, but the PSA, there is no violation of that. And if your PSA is high, so before we used to just take an absolute number for everybody. What we know now, if you are 40 and your PSA is above 1 already, like 40 years old and your PSA is above 1.5, you are high risk. If we don't biopsy you at that age, we need to keep you on the closer monitoring. Prostate cancer, if you have breast cancer in your family, this is your risk of prostate cancer. So, you know.
My eldest brother.
So like I said, if you wait until some people develop, but the salt thing, the pressure in the kidney that affects the blood flow to it. So the kidney tries to protect itself by constricting the blood vessels, and then it doesn't get enough oxygen, then over time it ends up suffering. So that's how high blood pressure, for instance, damages the kidney. There's certain allergic conditions that will cause damage. There are lots of different to prevent kidney damage.
Not kidney damage only, but prostate health.
That's the thing, if you knew, I mean, when it was known that certain parts of the world were black people had more, people went back to look at the diet. But so like I said, whether you live in the United States where diet is not the same as over there, the five states between India and China are always weak, and the condom level gets less and more black blood gets less.
A lot of meat. So we've been eating too much meat
Because
because
we are all related to the high carbohydrate diet that we store. And once insulin is around, you're not able to go and mobilize the fat. So you just keep storing a little bit, you get hungry, you eat carbs again, store a little bit. So that's why every decade we put on 10 and 10 and pounds. Although, so most of the diets we have are what they call type 2 diabetics. You're not lacking in insulin. You actually have high insulin levels, but your body is not able to respond to it. And some of the ways of reversing it is to go on a low carb or keto diet, as my friend would say. So less carbs in the diet, or you can only go by food instead of that. I lost 3 pounds. Actually,
how many pounds you lost?
from 20.
From doing what?
Low carb and keto, plus 20% fasting.
Thank you for coming and sharing with us your information on different kinds of cancer and real aspects. I guess it will be very nice to see you if you have time.
Yeah. Yeah, come and do the clinic.